Thank you, Ademola. Like my colleagues have mentioned, in the program that we just launched on the Free to Shine program campaign, is actually a campaign by the Organization of Africa First Ladies for Development, which our First Lady has just been elected as a member of the steering committee. The program aims to, for example, reduce the number of infections, new HIV infections among women of reproductive age, and also reduce mother-to-child transmission of HIV.
Okay. And
then lastly, those that are found with HIV to be HIV positive are put on antiretroviral medication. In terms of, going back to your question on the sustainability of the program, the RHI program does not embark on a program without including the relevant ministries and agencies that are involved. Now, yesterday, if you realize, when we were in Kaduna for the Free to Shine program, we had all the federal, international, and local agencies, including, religious and traditional rulers, all among, because the ministries are the custodians of this, healthcare, for example, the Ministry of Health. You have NACA there, you have National AIDS and STD Control Program, you have, all other relevant agencies there. So idea is to, and also the campaign, the First Lady, asks us to invite young people from high schools, from secondary schools, from universities, student unions, so that the campaign can resonate among these vulnerable groups. Okay. And that is how the RHI program intends to spread the word, so that it gets to the people that are affected the most. Midwives were there. They're very critical in our healthcare system. And they were there, and they received the message, and they were very, very happy, that the First Lady was there to listen to them, to listen to their problems. Let me also give you another example of testimony. We had testimonies yesterday, people living with HIV/AIDS that came voluntarily to state, for example, they've been living with HIV/AIDS, and because of the interventions of the state and the federal government, they've been able to live this long. Their children are healthy, and they even came. The First Lady was generous enough to give them a handshake, and that has gone a long way. She has listened to them. So it's a holistic approach to healthcare system. Whatever program the RHI embarks, it makes sure that all the relevant stakeholders involved are included in the planning and execution of the campaign. Thank you.
When you say holistic, I know that many rural communities struggle with access, to healthcare, facilities. So is the RHI also intervening by providing bridging infrastructural gaps, for instance, let's say building well-equipped maternity homes, for instance? Are there success stories to share?
There, we play a supportive role, right, the RHI, so which means there's a limitation of means. But within that limitation, within that limited resources, the RHI program has been able to reach, you can see the testimonies online, to reach the bottom line people, those people that are in the rural areas. Just recently, the RI partnered with the SDG program to provide empowerment equipments to market women in terms of deep freezers, generators, just to recapitalize their existing businesses. So the RHI program has reached the lowest of the lowest, actually, when it comes to even getting to the rural. Obviously, there's more that needs to be done, but within the limited resources of the RHI, it has gone on beyond.
In other words, you don't do infrastructure at the moment.
That's what I want to